Diaphragm, pelvic floor, and abdominals all move in a lovely coordinated dance to expand and contract your lungs and keep your skeleton in good alignment. Now, proper alignment, we really want to see that you're in a nice tall line. Your rib cage is aligned over your pelvis, over your feet, and your head is in a nice line with the rest of your body. You should feel that your weight is evenly distributed side to side, and you should feel relaxed but active. So we want to avoid the common postpartum and pregnancy posture that we see, which is where we tend to thrust our hips forward, slouch our back, let our shoulders roll forward, and our head juts out in front of us like this with our knees locked, and we're just kind of hanging out there with baby in the front or baby on the side. So let's kind of assess our own posture. Draw yourself tall out of that slouchy posture. Stack your rib cage over your pelvis, over your feet. Imagine your spine growing long. Untuck your bum, soften your knees. Bring your rib cage over your pelvis and your ears in line with your shoulders. Make your neck long. Bring your chin gently down versus jutting out up or to the front. As you're standing tall, I want you to open your collarbones. Feel that your weight is evenly distributed left to right and that your neck is relaxed. Note if your rib cage and chest are thrust forward or if you're slouching. Is your bum tucked? Release it. Soften your knees. Activate your leg muscles. Now read the lesson on breathing, and in the next video, we'll add that to your practice.